So, Dr. Chris Rolph, the plans have been set for September.
That's right. Schools should be back in September pretty much as normal. All children, all age groups should be back in, and parents have been told they have to send their children back to school.
Is this the right decision?
Well, I'm not an epidemiologist, so from that point of view, I don't know. But what I do know is children have been missing out on their education. And over the last 10 weeks, most schools have been trying to give the children the best education that they can. And the best way they can do that is to have them back in the buildings. I think what the politicians have finally realised is you can't have children in and maintain the kind of social distancing rules that they're expecting for the rest of the general public.
The plans have been published on the gov.uk website, and all of us can go and see what those are to our heart's content. But just to break it down, it's going to be implemented, as I understand it, in 5 key areas. Could you just tell us a bit more about those 5 areas?
Okay, so the guidance is in 5 sections, and it's the beginning and the end of those sections really are about public health advice and what schools should do in terms of health and safety, and what contingency measures they need to have in place. But the middle 3 sections are the really important ones for schools. So the first one is about school operations and how to work day to day. The middle one is about curriculum, behaviour and pastoral support. So what schools need to be teaching children, how they're supporting those children. And then the last one is about assessment and, importantly for school leaders, accountability measures. So those are the sections, but it's that middle bit that's the kind of meaty bit really, and what school leaders are going to have to get to grips with.
For the sheer amount of schools that there are in the country, this is not a perfect solution, is it? So a lot of work is going to have to be done between now and then to sort of work out the ins and outs of how it's going to work in each particular school. Yeah,
exactly so. And the only people that can do that are the ones on the ground. You know, the school leaders, head teachers, their teams. They'll run it past their governors, but they're the only people that can do it. The government can't issue guidance that has very explicit details about how someone can manage a school. You can only do that with your own school, and every single school is different. So in some they'll have a one-way system, in others they won't. In some they'll have bubbles of whole year groups, in others they'll do it in a different way. Some will have rolling lunch times, others will manage their lunch times in a different way. So there's a lot of work to be done, but that can only be done by the people that work in schools.
How easy do you think it will be to get the parents on side? Because we've run a poll on Twitter in the last 24 hours that 2/3 of those who responded said they're willing to risk a fine in order to, as they see, keep their children safe.
Yeah, I mean, that's going to be difficult. The good news is that at least this guidance has come out with a bit of time for planning. So we're still talking, 8 or 9 weeks away yet before all these children are back in school. So schools can make some plans and communicate with parents and say, look, this is how it's going to work for you. These are the groups that your children will be in. Ultimately, it will be down to parents. You know, the Secretary of State has said that they must send their children into school, and come September, the normal rules about attendance apply. I think it probably wasn't expressed very well in the DfE briefing, but nonetheless, if parents don't send their children to school, they do risk a fine. If they do send them to school, they may well feel that they're risking exposing them to a virus. And I think more than that, it's not just exposing the children. What we've seen so far of the virus is it affects children less than adults, but of course they could bring home infection back into the home, back to mum and dad, back to grandparents or whoever else is in the family bubble, and they could share it with their friends. It could go the other way. So we don't really know of the risks, but as we go over the summer, and we've got a relaxation today, right now there'll be people in the pub, we will see whether it causes an increased spike in the virus, and if it does, then we maybe have to have a bit of a rethink about how schools are going to work. If it doesn't, then parents...
We've got 2 months between now and then, though, to get some reasonable data in.
Exactly, yeah, so it'd just be interesting to see what difference the current relaxation makes, and whether that would affect the way that parents think about sending their children to school.
Reading between the lines, yes, we're talking about the schools and education, but do you see, if they follow through with the plans to have the schools reopen fully, even though they're at staggered times and break times throughout the day, for example, but a full school service from September, with the overlapping timeframes, the furlough scheme is due to end in October. Is this rubber stamping from the government's desire or their expectations that the furlough scheme will come to an end by October, and therefore childcare is such a massive issue for a lot of parents, but that is taken out of their hands if the children are back to school? Do you think this is the first realistic step into some form of normality across the board?
Well, I think it looks that way. I worry slightly that the government might be driven by economics and looking at what's happening with the national economy, and they really have to be driven by the health of the population. And there's a slight fear that we might be going too fast there. But as you say, the next couple of months will give us a bit more detail and data on that. I think you're right, though. If we reach a stage in October where all parents are back at work, then they'll probably be quite keen to see the children go back to school from a practical point of view, although they might still have those worries about the virus. It's going to be really hard for parents to decide.
So, long-term forecasting then, from a school's point of view, when do you think the earliest point will be where we see what we used to call a normal school day, with children all going in at the same time? And they're not too concerned about social distancing, they've said this week, but mingling with their friends, going in at the same times, having the same break times. How long before we see that, do you think?
I don't think we're going to see that before January at the earliest, because we need to have some sort of confidence that a vaccine's on the way, and we need to have some confidence that the virus isn't spreading among the general population and isn't being carried by children, and we won't really know that until they're back. So I think we'll see them back in these bubbles, year groups, classes, however schools arrange it, for at least that first term, and then there may be a change come January. But it's really hard to predict the future. Nobody's been in this position before. I remember when they said they were going to close the schools, I was amazed. I thought, oh, they're going to close schools for 3 or 4 weeks. That's ridiculous. These kids are going to miss school. And we've just entered a whole new world, so it's really hard to predict what it'll be like.
How easy or difficult do you think it's going to be in terms of SEND schools and children with those kind of needs? And a lot of parents of children with SEND issues are going to be listening to this right now, and it was difficult enough before. I mean, how easy will it be? Is it as simple as the parents have got to work with the schools, and vice versa?
Yeah, the parents will have to work with the schools, and I think parents of children with particular needs probably work very closely with the schools anyway. And some of those schools, I'm aware of some special schools that have just stayed open all the way through, because the only way that the parents can manage is by the support that they get from the schools. So they've been working with parents all the way. It's incredibly difficult, and I have to say it's probably quite risky as well to the staff, because they've got children coming in and out of school. Probably those children are probably working quite closely with other professionals as well. So it is quite risky, and some of those particular children might be very vulnerable to the virus too. So that's a really difficult situation, probably even more so than the many other parents that are thinking about sending them back in the autumn.
Yeah, because I was just thinking a little bit outside the box. Maybe if you've got, for example, a child who it's down in as a need, or an EHCP, for example, where they need to have a particularly designated space, and they've said they're not going to carry on with social distancing or worry about it too much. But if that space is taken up just to keep the children as separate as possible, there's going to be a huge knock-on effect. I mean, these kind of things are difficult, aren't they?
Yeah, they are. The way that schools use their spaces is going to be really difficult. But I think, as you say, they've recognised that there is no way of getting all children into school unless you cram them a bit more closely together than 2 metres apart. And that you just can't do that. I think the space for children with particular needs is probably less likely to be compromised from that point of view, but definitely the social distancing will be compromised, and that creates a vulnerability both ways around to the children and to the professionals working with them.